for a comment or some help for Hayley with respect to her patient?
Can I ask a technical question first, rather than the...
You can ask it. They're not getting an answer.
I've got a question for Tony, and it came up later with the other presentation. Do the rights of illegal SADC citizens, illegally entering SADC citizens, did I understand it correctly? If you sit in a SADC country and you come in either across the border with poor in the border, or you come in as a tourist and you have a medical condition, you come down to a center, you're not denied medical help.
Effectively, yes, but the contradiction was I think what the National Health Act states. Okay, they're the exception, yeah, sorry. So, yeah, that's the answer to your question for SADC countries. It was non-SADC countries where that contradiction would apply.
I just have a comment, and perhaps there's others in the audience that have shared the same experience. I must say that when I was in Gauteng, it was clear if you were illegal without documents, you could treat and go, the sky was the limit. It's a little bit more complex in the Western Cape. But in all fairness, for some reason or another, and we find that in pediatric oncology, our colleagues, our parents out in other countries come down and they tell me, and I've had now close to about 15, 16 of them over the 7 years that I'm in the Western Cape. They say they pay the ticket, usually up to Worcester, but sometimes further. But they bypass Limpopo, they bypass Gauteng, they bypass Free State, because they say we're not going to get access to care. We know we're going to get it in the Western Cape. And they come from all these places with passports and ready for the care. So I wonder whether that is a thing that other people are seeing, because it seems by word of mouth they've realized that they can get care here. And I must say, in all fairness, Tygerberg has been very supportive in allowing us to treat these children with cancer, regardless of age and regardless, because they have come with legal documents. They came with their passports, and they were not referred because they decided to get on the train themselves because of stockouts or whatever reason.
Thank you. I must say, 10 years ago, had a similar experience in Johannesburg referring a patient to oncology, and it seems that the Joburg Gen couldn't open a folder because the child was Zimbabwean. So it wasn't necessarily the clinician, it was above that. But then I don't see why, when you said that all SADC citizens are entitled to care, why this would be an issue. Is it only primary care that they're entitled to, or does it, yeah?
Yeah, well, in our case, it's not, the wording is right, it's basic care. I think the anomaly is also the distinction between, I think, what the basic one and primary health care, which is not the environment we work in, sort of seems to be different. Emergency care we do allow access to. So I think the dialysis situation was one, for instance, where it was a bit of a toss-up because the kid was going to go on a transplant program. This is where Prof. McCullough had sort of given some good insight in. So we do treat them regardless of whether they're SADC or not under those circumstances. But for a SADC patient, they would be able to go on prolonged care. If it makes sense. Dialysis, obviously, going into a transplant program, there are a lot more different considerations because you're a citizen or not type of thing.
Here we are.
So two comments on my side. So from what we've heard of the regulations, then it's clear that this patient then, on the basis of being a Malawian, who's part of SADC, actually then would qualify for these rights. And I think that's an important point for all of us, because I'm not sure many of us recognize that. The issue, though, is that if this is outside the SADC, we still then face the same ethical issues. And I think the law is clear about that. The other point I want to make is that, in fact, we have had further guidance from the Department of Health, and that's specifically in the case of children, because COMIC raised the issues 2 years ago about children, particularly non-South African children, coming to primary healthcare clinics, not having Road to Health booklets, often because they were not given it at birth because they were non-South African, even though they were born in South African settings, and then being denied services at primary healthcare clinic, including HIV tests and immunization. And COMIC took that up, and in fact, I'm going to ask to put it up, but in fact, there was a circular then that was signed by the Director General, which clearly says a number of things, including one, that all children, whether they're South African or not, have the right to get a Road to Health card. Okay, so that's the first thing. And the implication of that is that once you've got a Road to Health card, you get all the services in the Road to Health card. So including immunization, which we know can be very expensive. You know, pneumococcal vaccine is more than 160 rand per dose. So we do have some clarification on that issue. And that's not just SEDEC or non-SEDEC. That's all children in this country have the right to a Road to Health booklet. And I think that's quite a useful, not using the word weapon, but it's a useful thing, a useful tool for all of us to know.
I'm going to play devil's advocate here. The child with a stage 4 nephroblastoma with such a poor prognosis, if you look at it from an individual justice point of view or the child's best interest, is it in that child's best interest to put him through all of the treatment that you describe, with all the suffering, you know, related to that? And if he was in Malawi, he wouldn't be able to access those kind of services as well. Just another palliative-related things. These children that are allowed access to short-term dialysis, there was a whole population of them in Joburg that were in a private facility where they were providing them with dialysis. And then those 28 days expired, and they weren't allowed access to transplantation. And I was often called in to, well, then come and help withdraw the dialysis. And it's incredibly difficult to withdraw something that you've started. One should actually rather think of withholding than actually providing false promise for 28 days and then, you know, not being able to do anything further. So I think we need to think about the implications of our decisions.
Thank you. My question, or it's a comment sort of a thing, is based on the whole team. I'm from KZN. We're actually at the border of Mpumalanga and Swaziland. So we normally get lots of patients from Swaziland. They always come they leave their country to come this side for treatment's sake, not just that they got sick whilst they are here in South Africa. So what do we do in that case? And especially because it's very difficult to follow those people up, especially we've got lots of severe acute malnutrition coming from the other side. When we discharge them, we can't actually link them to anybody because they're from the other side. And after a few weeks, they are back again with the same problem. So what do we do in that cases like that? Thank you.
I think 2 years ago at the Bloemfontein conference, somebody working in Vicksburg said that there'd been an agreement between the Free State government and the Lesotho government on how to handle this cross-border trade in healthcare, as it were. So that there were ways that the Free State, maybe somebody from Free State can speak to it, that had related to Lesotho about Lesotho's citizens coming in to get some of their care within our country. Is there anybody from Free State who could talk to that a bit further? But that sounds like a sensible model where two governments, one's a province and one's a country, but could come up with something.
Thank you, sir. I'm not from Free State, but I'm from Eastern Cape, borders of Free State and Lesotho. We were also trying to find out about the people from Eastern Cape, the borders of Eastern Cape to Free State. Then we were also informed that the Lesotho has paid some of money for their patients to Free State, yet we haven't done that as Eastern Cape to Free State, as a province of South Africa, both of us. But Lesotho has some of money that has been paid to Free State for the patients to go there.
Does anybody else want to comment on that? Are there any comments from Polokwane, right, or beyond, right on the border with Zimbabwe, with the huge refugee crisis? Please speak.
Hi, just in terms of the KZN experience with the SAM patients that we've had, in one of our district hospitals we noticed that our SAM patients had decreased, but we got to a level where we couldn't tease it out, and when we teased out foreign patients versus South African patients, that's where we were battling. And with all the linkages to CCGs and everything that we're talking about, I think that is a real problem, is that we're not going to be able to overcome that, where patients are coming and going all the time. And we're not going to be able to do that linkage to follow them up and to make sure they get proper care, etc.
I want to be a little bit controversial. So, I mean, everything looks really nice. These children they have the right to health care. But what level of healthcare? So, for example, all of us operate under limited resources. We've got limited ICU beds, we've got limited dialysis, etc. How does a South African citizen feel if their child is denied access to an ICU bed or to dialysis, but there's a foreign citizen that is not documented? Do they have any right? I mean, I know that we're talking about xenophobia here, but I just want to know, it is out there. And I'd like some opinions and some discussion regarding that. Because it's fine when you've got no limitation on resources. But if you do, what do you do then?
Good morning. I am Zama Mkumane from Umkanyagute, which is in KZN. And our neighboring countries is Mozambique and Swaziland. Well, with Swaziland, we don't have a problem when it comes to the language or to communication, but with the Mozambican citizens, it's a challenge. And I just want to know that how do we deal with the language barriers? Who to contact? Thank you.
In the Western Cape, there's a translation service that is available to the healthcare system, where you can pick up the phone and you have access to an interpreter. I'm not quite sure how widely that's available elsewhere in the country, but definitely something worth exploring.
That service is only in the one, and I can't remember its name now, but that one is only in the province.
But it is a commercial company, so it would be possible for other provincial departments to take that on.
You could say that now we're going to spend money on translation services and going to add to the whole cost containing, but the wonderful thing about this service is that you can use it for local languages as well. But the communication is a major issue. Here we have a child with cancer. You're going to try and explain in some foreign language what's required. Are they going to understand? Are they